I am Dr. Mitch Harlan, and welcome to the Truth Talks podcast. This week's episode features incredible faith, unconditional love, and amazing courage. Adam and Whitney Dinkel hear for the first time that their unborn son has spina bifida. They are faced with challenges that only they can describe. Tune in as we discuss this miracle 4-year-old internet sensation that has touched the world. Welcome to Truth Talks Podcast. I'm Dr. Mitch Harlan, and I am here today with Adam and Whitney Dinkel, and we're going to be going over the Defying the Odds Romans Journey. How are you guys?
Good.
Feeling good, Roman? Yeah. I like your glasses. Are those new?
Yeah.
So you guys are not shy of the camera. You've been on it quite a bit. Is that correct?
Yeah.
And tell me how that's been. Is that something you enjoy, or are you kind of like over it?
It's been nice to share Roman's journey because that's why we started his Facebook page anyways. But it can kind of become a lot after a lot of a couple years ago when we were doing interview after interview after interview. It was a lot, but not bad.
I remember seeing that. I mean, you've done a lot of interviews, and we're going to talk about that kind of as we get going. But today's podcast is a little bit different. We're actually going to really talk about the story behind the scenes, which is your guys' story. There is no defying the odds without the support of the parents and kind of all that you guys have been through and went through. And we're going to talk all about that. I know you guys have a huge following, and what I really want to do is kind of highlight who you guys are, because that is to me one of the most impressive things about this entire story. So I want to just kind of go along on a few things here. You have 3 children, right?
Yep.
And none of the births were easy. Is that correct?
No.
Give me a little synopsis just to the 3, what you went through.
So Leighton is our oldest. Leighton's 8 years old. We went in at about almost 39 weeks with him because she went into labor. And basically the end story is he was frank breech, so we had to get rushed off for an emergency C-section for him. They pulled him out and he was purple. He had an APGAR score of 1, and the nurse came over and told us he had Down syndrome. So we had to wait about 2 weeks until genetic testing came back to show us that he actually didn't have Down syndrome. But it was a pretty wild ride to deal with that for the first 2 weeks, especially as new parents, and we were newly married at that time, and it was interesting.
Scary.
That was number 1. Tell us about number 2.
So number 2 is Gracie. She is almost 6 years old now. She was born on July 3rd, almost made it to 4th of July. But when I was about 22-ish, I think, or so, 22-ish or so weeks with her, I called Adam at the office one day because I just started having like these terrible pains in my stomach and I didn't know what was going on. It had made me get sick. And so he came home that night and I was just like curled up in a ball in bed, and he's like, that is not normal. And so he called our midwife and she was like, yeah, you probably better go in and get checked out. So we went in and found out that I was having appendicitis. So I had to have my appendix removed while I was pregnant with Gracie.
And then number 3.
And number 3 is Roman. And his journey was not easy either. At our 20-week ultrasound with him, we found out that not everything was right with him.
And we're going to go into all of that, right? But I think it was kind of interesting to highlight that you guys were 3 for 3. Now, I know a lot of our audience and people don't know you, but number 4, what are we looking at?
We already had another dog.
There is no number 4. It's it. You guys are like, no, we made it 3. We're done.
I was like, wait. No, I had my tubes tied after I had Roman. So
Probably a pretty.
I worry about that chance.
Yeah, number 4 would have been that's a heck of a roll of dice when you're 3 for 3 with that kind of story.
well, it's funny because I look back on my pregnancies and I'm like, oh, I had great pregnancies, and then I'm like, actually, I really didn't at all. But for some reason, with Layton and Gracie especially, like my pregnancies were great, other than Layton's birth, and then Gracie, me having to have my appendix out, but everything else was good.
Yeah, labor and delivery on Gracie was about as perfect as it could have gotten.
Yeah.
Well, we can't have a podcast without highlighting a little bit of the star of the show. So, Roman, how are you? Are you having a good day so far?
Good.
Oh, say yeah.
Yeah.
Tell me what you enjoy doing. You love swimming, don't you?
Yeah.
Yeah. What else do you enjoy doing? What about Disney? You like Disney?
Yeah.
You got to go there, didn't you?
Yeah.
Yeah. Tell me a little bit about Roman's place down like in Disney. He's got to go all over the place, hasn't he? He's been in New York.
Oh, yeah. Well, he has been traveling more than probably most of our kids, but we went to, his first big trip was New York City when we went on to GMA Day, which was like a 36-hour adventure of flying down there, staying a night. And we flew with Maggie, too, when Maggie was a puppy. So having to fly with a puppy in Times Square with no grass to go to the bathroom. And then him. And then the show was an adventure itself. It was really cool, but it's always a little stressful doing those things. But it turned out really well, and he did good.
That's a well-traveled young man.
Yes, he is.
That's pretty awesome. Do you like airplanes, Roman?
Yeah.
Do you? You like to fly? You like to be high in the air?
Yeah.
Me too. I enjoy that too. I love the things that you guys do when you're filming him at night. I mean, of course, we're family, so we're going to watch it all, but those are actually really entertaining and really awesome how he does that. He's not shy of the camera, is he?
No.
Yeah, especially if he's getting ready to go to bed and he wants to be a giant ham so he can stay up later. So that's when most of his videos are done at probably 7:30, 8 o'clock at night because.
But if he ever doesn't want to do one, we don't do it. I mean, it's totally up to him.
Does he ever not want to do it?
Oh, yeah.
He's 4, He has opinions.
So everything about being a 4-year-old is exactly about being a 4-year-old with him too.
Yeah.
There is no difference.
No.
Now, how is he? How is he on the level of where he should be? Is he right where he needs to be?
Mentally and cognitively, yes, he's right where he should be. He is behind with his gross motor skills.
And fine motor skills he pretty much caught up with. Right?
Yeah, he's still getting OT, but he's pretty good on his fine motor skills. But he is a little bit behind with his gross motors, but he can keep up with his classmates pretty well, I think.
Well, he, I was kind of jealous. He, Roman, did you enjoy hanging out with the Kansas City Chiefs?
Yeah.
I haven't got to hang out with the Kansas City Chiefs, and that's what I really want to do. You got a shoe from somebody.
Whose shoe was that? You remember?
Yeah.
Who?
Mom.
Pat Mahomes gave him Travis Kelce's signed shoe, or cleat, I guess.
Oh, my goodness. And the Kansas City Royals. He's hung out with the Kansas City Royals.
Yes, he has. That was a blast, too. He got a
And I got a ball.
He did get a ball.
They gave you a ball. I saw you got to hang out with the cheerleaders, too.
Yeah.
Did they think you were pretty cute?
Yeah.
Yeah, I bet they did. And didn't you get to run a tee out or something, or you had a tee or something on a kickoff thing or something?
He got the game ball at the Chiefs game, right? Yeah.
So we got to be on the field for the opening ceremonies and stuff.
And I get to walk. I got to walk on it.
He got to walk on it.
Got to walk on the field. Oh, my goodness. I've not even gotten to walk on the field. I want to. Well, Roman, I loved having you on. This is fun. You look good. I love your hair.
Bye.
Bye.
Bye, you sweet little thing, you. Oh, love you. So you as dad, interesting journey for you.
Absolutely.
It's been it's one of those things. Again, when I'm doing a podcast, especially with somebody that I know real well, I know you have that nervous energy, and we're going to get to that a little bit later. And we're going to talk about what it's like when you find out something like that's going on, and kind of, again, you being a doctor with a lot of knowledge that you had and kind of going into it. We're going to kind of get to all of that too, because again, this is the highlight of your story. This is the highlight of what you guys have been through, what you did, some decisions you made, and we're going to highlight all that because I think you guys have done just an absolutely spectacular job with it.
Thank you.
Yeah, no, it's true.
It's a wild ride too, but I mean, and I do have a little bit. I mean, I have more of an anxious personality, and Whitney's she's like Rod. She's calm and collected, and is able to just be chill with a lot of this stuff. So we are definitely the yin and the yang to what we deal with, but we balance out pretty well. And my anxious energy is what gets stuff done. So
I would have needed that too, because I'm very similar to you in the fact that when something like that happens, I can almost handle anything in life, but if I think there's something with my kids, that sends me through the roof. I mean, way more than business, way more than anything else. It's one of those things where I'm literally like you can feel that anxious tension and that energy kind of rolling up, and man, you went through it 3 times.
Yeah.
That's not easy.
But I mean, it's crazy just to see how kind of God prepares you for this stuff. I mean, it's, and you don't look at it, it's all in hindsight. So like Whitney said, our pregnancies didn't seem too crazy, but once you start kind of putting the pieces together, you see how all of this plays a part to, oh, well, now we were mentally getting prepared to have a child with special needs. And now we are having a surgery during pregnancy. And then we throw it all together for Roman, and then we have a child with special needs and had surgery during pregnancy. So it's crazy.
That's a phenomenal segment, and that's exactly where we're going to go with this. Because again, this story is just it touches worldwide, and that's what's incredible about this story is the story behind the scenes, the story that they don't know, but they're getting ready to know it right now because we're gonna talk about that. I want to jump right into it. So you have the ultrasound of Roman, and something's wrong. Tell me a little bit about that once you got that ultrasound.
So we went in for just honestly, I didn't even want to do the ultrasound. We didn't think it was necessary, or I didn't at that time. But we ended up doing it. Something was kind of pulling us towards it. And now we know it was definitely the Holy Spirit. But we went in for this ultrasound, and I honestly sat there and listened and watched, and we weren't going to find out the sex of our third. It was going to be a surprise. So we just went through and talking, but Whitney felt something was a little off during it. I mean, I'm obviously...
Well, from the very beginning of my pregnancy, I felt like something was off. I was just so nervous. I just couldn't be calm. And I thought that's because I had a miscarriage before, and I just thought that I was just worried about that. So my midwife actually did an ultrasound way early on just so I could see the heartbeat and know that everything was good. And that gave me a little bit of peace for a little bit. But then still something was like pulling at me, like just, I don't know, just in the back of my head, just something didn't seem right. So then we were at the ultrasound, and the ultrasound tech kind of got quiet. She was talking to us at first, and then you could tell she was like concentrating a little bit more. So that's when I knew. I was like, oh my gosh. And he didn't care at all. I mean, he had no.
It's very typical of our life in general.
And so when we left that room, she said, good luck with everything. And I was like, oh my gosh. And still he's like,
well, it's funny because little comments like that I would normally pick up on and really overanalyze, and she did for that particular time.
Yeah. So I remember sitting out in the waiting room before we went and saw our midwife, and he was like sending the ultrasound pictures to our family, and I saw my midwife like go down another hallway. I was being a huge creeper. And I was like, oh my gosh, she's going to talk to the ultrasound lady. And I just knew it. Like, I just knew this was not good. So we went back into the room, and what did she say when she came in?
Yeah, she walked in and was like, I've known you guys for a long time. I'm just going to cut it to you straight. There's something we're seeing on the ultrasound that isn't right. He's got fluid built up around his spine and some extra fluid in his brain. And she basically said, there's nothing. We kind of asked a couple of questions, and she's like, there's nothing information I can give you with this. We have to get you over to do a level 2 ultrasound with what we call an MFM, which is a maternal fetal medicine specialist. And level 2 is exact same ultrasound. It's just read and interpreted by a different level of physician at that point. So this was Friday afternoon, and she said the earliest they can get you in is Monday. So that was probably the longest 2.5 days I think I've had. I remember going to our church, and I was serving at our church at that time, and just being kind of circled with our pastors and then praying over us and just praying for like this complete miracle that something was wrong, and that or something was mistaken and everything's okay with them. And it was
really trying just to stay positive and trying not to think about it, which is really hard to do.
Well, that's a tough 2 days. I mean, my goodness, that I can't even imagine. Were you having any symptoms, or you just had this intuition that something wasn't quite right?
No, I mean, I didn't have any sort of symptoms or anything. I just an intuition, I
Oh,
guess.
so you had this kind of intuition, then you find out this is going on. Was it a kind of a relief, though, that she just shot it straight with you versus not giving you any information? Or
No.
I know.
So it was worse. The 2 days, you're like, oh, my goodness.
Well, and it's hard because I know what those look like, and I knew her saying it was a neural tube defect, and we just didn't know the severity of it. There's a lot of different severities, and Roman could be kind of in the middle of it. There could be a lot of things that are worse with that. So,
I asked her straight up. I was like, "Is my baby gonna die?" And she was like, "No, I don't think it's anything like that." She was like, "He may have to have like a surgery after he's born or something," but she didn't want to say too much because she honestly had never seen anything like that before. So she was just like, let's just go to the specialist, see what he says. And she kind of just left it pretty vague.
Now, at this point in time, there's no diagnosis. Nobody's saying anything. They're just telling you this.
Yeah. And we were like, well, people make mistakes, maybe it is a mistake. Like maybe everything is fine. And he was just laying weird or, something. We were just really hopeful and prayerfully hoping, I don't know if it's not right. Anyways, really just hoping that everything was just a mistake and that we were going to go into our level 2 ultrasound and they were going to be like, no, everything's great. You guys are great. I don't even know why you're here.
Well, that's wonderful. And that's the one thing that I really want to touch on this topic with you guys is I know your faith is strong. And you've already alluded to it, Adam, but that I think is something really huge, and that's why I love this story. It's such a feel-good story, and we've done some pretty heavy podcasts here lately, and we've got some in the queue coming up, and it is kind of interesting how faith plays such a role when it comes to something this big, and it obviously did with you guys.
Yeah, when there's no one else to rely on. I mean, we had each other and we had God, and that's kind of what we agreed we were going to base our marriage off of when we got married.
And because of our faith, we knew that everything was going to be okay, no matter what happened.
Yeah.
Well, I've got some questions coming up for you because I think that everybody listening, it's got to shake you. It's got to shake you to the core, and then you got to make some decisions. So we're going to let's go from that to then the diagnosis. So you meet with this specialist.
Yeah, so we go into this room. It's dark. I don't even know. I remember looking at all the people in the waiting room being like, this is not us. Like, we should not be here. Like, things like this don't happen to us.
Yeah.
We're young, we're healthy. Like, this isn't just the way it should be. And so we go back to the room, and it's a pretty big blur to me what all happened.
Well, he was pretty quick to give us a diagnosis at that point. He went through the scan and was like, okay, it looks like your son has a myelomeningocele, or not son at that point, he didn't tell us the sex, but has a myelomeningocele. It's a form of Spina Bifida. It's pretty low. There's a few options that we have with this particular case. His first comment was, we live in the United States, so your first option is termination. Threw it out there, and he even made some comment like, this isn't something I would do.
No, I think you asked him.
Oh yeah, at the end what he would do. So yeah, so he said that, and then he said your second option is kind of the typical medical intervention for it, which is a postnatal repair, so they would schedule a C-section for him. have him come out, and then at that point, usually within a couple hours, they would take him into surgery and repair his spine. But he would have to have a little bit more like hospital time and recovery time. And then he said there's a third option, which is a new option. It's called a fetal repair. So they would go in and fix him at 25, 30 weeks, and decide what going to fix him at that point. And then when she'd have a second C-section when 37, 38 weeks, and then he'd be repaired by the time he came out.
Now they're telling you this, and I already know you. You heard meningeal, being a doctor.
Absolutely.
What was your first thought?
I mean, there was a lot of thoughts at that point, but I know how severe this stuff is. There's nothing like having a child and picturing his life flash before your eyes before he's even born, of surgery upon surgery upon surgery, and then wheelchair and bowel and bladder issues. And then they give you this like Xeroxed sheet that has all this information, which is somewhat accurate, somewhat outdated, but just something that
basically the worst case scenario of what could happen.
Now, this was not the surgeon though, right?
No.
Okay, so this is the specialist that you're meeting there, and he's giving you these options. What'd you guys do when you were driving home? Did you discuss every option? Did you lay it all out? Did you consider each one of the options equally?
I remember we were driving over to her brother's house because that's where our kids were. And I remember driving down the exact same street, exactly where we were. And I just remember closing my eyes and thanking God for this, even though it hurt. And it was crazy. I mean, there were a lot of tears shed on that drive home. It wasn't like, oh yeah, we're gonna do this. It's gonna be fantastic.
It was easily the worst day of my life.
Yeah.
Thank you for your honesty on that. I think that's so important. It's so important for people to hear. Because I know you and I talked about it. And I remember that conversation vividly because I remember after we hung up the phone, I was thinking, man, what would I do? That there's all kinds of decisions that you make and your brain gets kind of colluded and cloudy because I'm the same way as you, Adam. I would think, okay, man, what's his life going to look like? And then you got that balance of, am I bringing a child into this world that's going to completely struggle? And man, that is like, it's one of the toughest decisions ever, I think.
Well, and it's the big picture thing too of our other kids, and how this is going to affect them.
Before I even thought of any of that, like I remember sitting in the chair crying after he gave us this diagnosis, and I was like, he said termination, and I was like, are we making the right decision to keep him? Is he going to suffer, his whole life? Like, is that selfish of us to want to keep him? And then I was like, what do you do? You terminate this baby, try to have another perfect baby? What if something's wrong with that baby? Like, I can't play God. I'm not God. I'm here to do what God wants me to do. And he gave us this child for a reason, just the way he is. And that was my big thoughts. And it all happened so fast. And then that's when we were driving home or driving to go get our kids from my sister-in-law who had them. And I remember her praying with us, and it was hard.
One of the things that I know about you, Whitney, and your grandmother, my mom, of course, in that whole lineage of women, I can't even fathom find a better mom. My mom the way she is, you the way you are with your kids, gosh, Shane with her kids, your mom to you. I mean, she would do anything. She'd drive 1,000,000 miles to come help you guys out with the kids. You are some of the strongest women, strongest mothers I've probably ever seen, and that's why you're skipping ahead of me here. I had this whole fantastic line of questioning, and here you are. You're already going over it with me, but that's all right. It's the way I like to do it. I really did want to focus in a lot on you with that decision, and your feelings and your emotions towards it. Again, from the start, termination was not even in the playbook with you, right?
I mean, it was that split second thought in my head, like, are we being selfish? And it was a split second. And then I was like, no, it doesn't matter. Our feelings, like God gave us him just the way he is. Like, it doesn't matter. We need to do, this is what God wants. And we know as Christians to trust in God and that everything's going to be okay.
So you made that decision. It's like, all right, here we go. Next level. So then what happens?
Then I was like, okay, what do we need to do to give him the best life possible? And that's when fetal surgery really came into play.
And realize this appointment was like at 7:30 in the morning. We're talking, all these decisions are made by 1 o'clock that afternoon. So this isn't like 5 days of sitting around thinking, we don't
have the luxury of time when you're talking fetal surgery. It has to be done by 25 weeks gestation or you don't get to do it. So it was quick.
And why did you choose fetal surgery over the surgery post-birth?
So after we got home, the Fetal Surgery Center from St. Louis, through Cardinal Glennon in St. Louis, gave us a call. And she's a nurse, and she answered any questions we had about it, and we had a lot, obviously. So I just picked her brain. And so basically the main differences with having fetal surgery is, number one, it could decrease his chances of needing a shunt, because with spina bifida, you typically have hydrocephalus also, and he did. I think it decreased the chances by 40%.
I think it was like 80% of kids without fetal repair get a shunt placed, and I think it was 50% after fetal. So fetal repair kids have a 50% chance. So the 30% decrease.
Yeah, so there was that. There was his walking. So you have his lesion level where his spine is out of his body, and that was at L3, they told us, which means that from his knees down he could be paralyzed. And having fetal surgery, you get his back closed, and with it being closed, then no more damage can be done. So by 25 weeks, there would be no more damage done. If we waited until birth, he could still be having damage to those nerves all the way until 40 weeks. So they give you I think is it the odds or?
Yeah.
I don't know. So instead of having an L3 lesion, he would function more at an L5 lesion.
It was two lesion levels down. So the lower you go down in your spine with this lesion level, the better function you'll have overall.
The better chances of walking. And so that was a big deal. And then he also had what is called a Chiari type 2 malformation. So his brain was being pulled down into his spinal cord. And then having fetal surgery could completely reverse that, and his brain would go back up to where it should be. And some kids who have a Chiari malformation have a lot of trouble with that. They have to have a trach. They can't eat. A lot of difficulties with that. So that was a big deal too. So with all that being said, I heard good, and I was like, okay, this is what we need to do. But those are just chances, and that's when.
And the way I look at it, she looks at it from the good. I look at it from the risk.
I knew that was coming. That's exactly what I was going to ask.
So that poor nurse, her name was Kate. She was the nurse coordinator. She got grilled by me for all the questions that I need. I always kind of smell cell and medical. So I know there's this new procedure that they're doing, and, that's wanting this data and all this stuff. So I look at it from that perspective on, do we want to be a subject in the study, which is really not the case. Find that out later. But, or we want to just kind of stick where it is. The thing with me is, she's looking at it from the perspective of, I'm going to do anything I can to give my baby the best possible life. And that's kind of where she was at. I look at it from the perspective of, we're going to have this surgery that could possibly risk losing my baby, but on top of that, risk losing my wife. So then I have the situation where, are we pushing this? And how would I look at it if I said yes to this, she went into this surgery and had uterine rupture or something and passed away, and we lost the mom of my two kids and my baby on the process of something that wasn't really quite necessary at that time.
Yes, that's right down my question list. That's exactly what I knew you would probably go down. But Whitney, in your case, you were go, right? You're like, these are the best odds, best chance. Let's go.
Yep, and he was like, and then there was also the aspect of like, how are we going to make this work? Like, I was for sure going to have to be gone 2 full weeks, but depending on how I did after surgery, I could potentially have had to stay there throughout the entire pregnancy. So we had 2 young kids. Gracie was 8, not even 18 months yet, and Layton was 2, 3, just turned 3, I think.
No, he was almost 4.
Okay, just turned 4. I don't know.
Yeah.
How old
A
was
lot
he?
going on.
So I had never even left Gracie. Like, it was a big deal for me to leave my kids. Like, I don't leave them. They're home with me all the time. So there was that. And then
I had my practice, and that was our one source of income that we had. So the idea of having to take off all of this time, and be back and forth, and who's going to take care of our other kids while this happens. And, just that was a huge fear, a financial fear.
yeah.
And,
So we had to be like, is this even going to work? Like, we don't even know. But one by one, the doors started opening. His parents were able to come up and stay with the kids during the week. And then my mom was able to come up, and she actually had to come stay with me. I had to have somebody with me 24/7.
your babysitter.
My babysitter. So my mom was able to leave her work and do that. And then my dad was able to come for a week. And then my mom actually, they were going to let her work from home. So she was going to be able to come back here and help me take care of the kids after the surgery. So things just started pointing us in that direction.
Because with this surgery, it's not like she recovers. You have a C-section, you open your uterus, and then you have a baby that's still kicking and rolling around inside of there. So she was on extensive bed rest where she couldn't go up and down our stairs more than once a day. She wasn't allowed to pick up our kids, or stand for long periods. Yeah, it was a wild.
How many surgeries had this doctor done?
48 at the time.
Yeah, we were number 40.
I mean, that's important. That at least they had done quite a few. And this guy's pretty world renowned. Is that correct?
Oh yes, we love him, but he moved to Orlando, so
and that's the neurosurgeon. The MFM, Dr. Vlastos, is phenomenal too. So
yeah,
there's two different teams. There's an MFM team, which is for mom, and then there was a pediatric neurosurgery team, which was for Roman. So I think there was like 17 people in the OR on that 5-hour-long surgery.
Kind of sounds like answered prayers to me. Like, you guys had this amazing faith. You went with it, and it looked like everything just kind of turned out the way it was supposed to.
It did. It really went well. Like, one of the big risks of having a fetal surgery is preterm labor. And I think at the time, St. Louis's, what was their?
I think it was like 32 or 33 weeks.
Yeah, like the average gestation after fetal surgery was like 33 weeks. So you're talking, you could have serious
complications.
Well, yeah, with Roman, like preterm labor and him being a premature baby. So he could have a lot of complications just from that. So we were really, really blessed that he made it all the way to 36 weeks and 3 days.
Well, yeah, especially because she had contractions all the way through. So as soon as she got home, from the time we had the baby, it was constant contractions. Me calling her, how are the contractions doing?
They weren't real contractions. They were Braxton Hicks contractions. So my doctor was okay with me having those. If they were real contractions, I would have had to have a C-section right then and there. But he was okay with me having the Braxton Hicks contractions. But still, anything on the uterus at that time with an open or with a freshly healing scar is.
Well, I want to talk about that. So I want you guys to describe the actual surgery, just so that people know exactly what you went through.
Yeah, go ahead.
So basically what they do is it has to be done before 25 weeks gestation. And there's 2 different types there's a fetoscopic one where they do it in a little camera and they go inside. And then there's the traditional, the original one that they were doing. But
Open.
yeah, so what it looks like is they basically open Whitney up from hip to hip. They pull their uterus out, put a small incision in her uterus with these special type of sutures that don't allow bleeding, because the uterus is very vascular. So if you slice the uterus, she'll bleed out within minutes of growing a baby. So once they get what they find with an ultrasound where Roman's butt and back are, so once they get that position, they pull out the back and the butt, and then they have the pediatric neurosurgery team come in, and they basically push his whole spinal cord back into his back, and then suture up all the different tissues, the muscles, the skin, everything from that point. And then they sew Whitney back up and put her on, it's a blood pressure medication, I forget what it's called, but it helps prevent contractions. So she isn't going to contract, because if she contracts, it can rip that incision, and then again, you'd have uterine rupture and she would bleed out, and then we'd lose both of them.
Well, and right after the surgery, they had me on a magnesium drip, which if anybody has had that, it is terrible. Like, you are so hot. I had a fan like blowing right in my face. It makes you sick. I mean, it was terrible, but
she'd be having conversations with me and then just pass out, like right into it. So I'd be talking to her and I'd look over and she's asleep, which isn't that abnormal for a Harlan, but
truth to that.
That's definitely an interesting.
So I've got a question for you, because as I was researching it, even back then, I wondered this, and I don't know if you guys have asked this question, but I'm dying to know. Do they feel like Roman had any pain when they were doing that surgery?
They gave him an injection.
They did.
So, for all these things, and this can be, I don't know, but they say that babies don't have pain and all of this stuff, and there's certain developmental stages. So Roman was 1 pound at 25 weeks.
No, I was 23 or 24 weeks when I had the surgery.
So he gets some of the anesthesia that Whitney got, but they also give him a pain injection into his tiny little butt to help with pain too. So he definitely, they said I don't know, they're kind of weird about it, but yeah, he definitely has pain. I mean, at that point, your pain receptors are there, like he can feel it.
We just try not to think about that, because that's hard to think about. Your little baby, there's nothing you can do.
But honestly, that was one of the selling points for me on doing the fetal repair, is because he has an option to have brand new into life. And anybody who's had a baby, the first day is so crucial into their life. So brand new into life, he would have went in to have to go to surgery and then lay on his stomach for 5, 6, 7, 8, 9 days until he's recovered. For this option, he was able to have a surgery and go back in and recover inside his mom, and inside that loving, like, innate environment that God gave him to recover in, and to grow in.
That's just a miracle in and of itself. I love where you went down with that, because I would think that same thing. I just had that curiosity because I couldn't really find anything on it. And I did figure that there was obviously pain receptors, and I just wondered how they handled that. But yeah, that was something I was very, very curious about. But I love where you went with that, and makes a whole lot of sense, right? He got to recover in probably the best hospital ever.
Yeah,
he's inside the womb.
Inside God's hospital.
That's the God hospital, man. That's a good place. That's a good place to be if you got anything, right? No better place than the God hospital.
When I woke up, they do ultrasounds like all the time when I was in the hospital afterwards. And at the very first ultrasound, they saw him kicking, and they told us, don't expect him to kick. When the nerves go through
it's like a nerve shock. So anytime you touch a nerve, it basically cripples that nerve for up to 24 hours.
Yeah. So they were like, it's okay. Like, we won't really know until the 48-hour mark how he's doing, but just don't expect him to be kicking and moving around like he normally would. And we saw his little legs kicking and his feet moving. And so that was just okay. It was worth it. He's doing good. I don't know. It was a crazy experience.
Well, that's where I want to take the next segment. So up until surgery and even after surgery, did they give you a prognosis, or was it just a real big guess? We don't really know.
I mean, they gave us the numbers, and they still do the numbers a lot. So L3, this is what his function level is going to be, which is completely wrong, because Spina Bifida is considered a snowflake condition. So even if you have the same lesion level, same everything, you're going to have your own specific set of circumstances. So for us, they tell us, that his legs probably aren't kicking. They told us for our first ultrasound.
Yeah.
Their legs probably aren't kicking. It's probably just his body moving in the not the cerebrospinal fluid, the amniotic fluid, creating this like optical illusion, basically. So they started us pretty low on the hope scale with that. But I think that's kind of their job, is to give you the worst case scenario so you kind of know what you're looking at.
And then having to have a shunt, which I think the doctors told us when we met with the fetal surgery team before we even had surgery that he had a high chance of needing a shunt, whether we did the fetal surgery or not, just because of how high his hydrocephalus already was at that point. Ventricles. So we kind of knew, I don't know, that wasn't one of our huge deciding factors. But so yeah, there was the brain damage. Like I said about the Chiari, you have eating issues, you can breathing issues, needing a trach, like speaking issues. I mean, it's just a lot of unknowns. You could have this, you could have that. We just don't know.
Well, tell me where he's at now.
Now he's doing great. He is definitely on level with his peers, if not above, with speaking and communication. And I mean, everybody's shocked when they meet Roman and kind of know where he's at. And that's one of the biggest comments we get from people on his page is, how old is this kid? Because he's super smart. He puts things together really well. So it's not like he's just speaking. He understands kind of what he's talking about. And he's just a great thinker, which is awesome to see.
You can see that in the video. One of the last ones that he did as you were putting together his breakfast sandwich, he nailed English muffin. And when you ask what kind of bread it was, I was sitting there thinking to myself, what do you call that? Oh, yeah, he just totally nails English muffin.
I know. I was like, what?
The stuff he shocks me with.
Like, he listens. Like, he hears us say that, and he remembers it. It's not like we were like, this is an English muffin, Roman. It's just he just picks up on stuff. And
well, it's just like him introducing every video that he does when he's like, hi, guys. That's her. That's her for every video. So he sees that, and now he knows that's what he's supposed to say when he starts those off.
Does he tell me kind of a average daily routine for him though? How about his bladder, his bowel, walking?
So he does have bladder and bowel issues, but that does not mean that he's going to have to wear a diaper his whole life. There are many, many options for him in this day and age, and we are very blessed to have those options. So right now, he just turned 4. He does wear a diaper for his bladder. His bladder and kidneys are very healthy, which is really good because with one hand of spina bifida, you can have unhealthy kidneys and bladders and have to take medication. On the other hand, you can have really healthy kidneys and bladders, but that means that he's peeing all the time.
You're not able to hold your urine at all.
Yeah. So he does have to wear diapers for that. But he does a bowel routine every night. Basically, we flush out his bowels and he goes to the bathroom and the toilet, and then he doesn't need to use the bathroom again for 24 hours until the next night when we do it. So he doesn't have accidents in his pants. Yeah.
Which is good. Yeah. I mean, that's good for him being able to go to school.
To have, you know what I mean? So that's
well. And I don't remember who we were talking to. I think it was actually the urologist. She said back in the day, you could tell when you were on the spina bifida floor because it stank.
The smell.
And as sad as that is, and that was a big issue, not just for people because they were having to wear diapers, but socially. So that is one of the things that has changed so much over the years, and one of the things that we don't have to worry about with him. And then with his bladder, we do have options. We're not quite ready to pursue those options yet because it will probably require medication and some other things that we don't really feel is necessary right now at this time. We'll definitely get a handle on that before he starts kindergarten and is old enough to be like aware.
Now, are there any more surgeries that he might need?
There's always a risk And it's something I don't think there's more than a couple of days that go by that I don't think about it, but there's a tethered cord surgery. So what happens when he gets his back repaired, once you get to your lumbar spine, your spinal cord is not a cord anymore. It's called trochanter equina. It looks like a bunch of hairs. So what happens when they get that all fused up is those little cords can get stuck in the scar tissue. So when they grow taller, it gets stuck and he starts to lose nerve function. So, he could just randomly one day not be able to walk, or not, it's slow, but, his legs get weaker, his bowels become different, just different symptoms become different. And then they go in and they have to, basically untangle those cords and fix it, which is not a fun surgery for kids to go through because they're not able to, at his age, from him having to lay on his stomach for how long does it usually?
I don't know.
I try not to think about it. Yeah, but it's not easy, sedate your kids so they don't move so they can heal.
And not only that, but going in there and messing with those nerves, you could easily damage more nerves.
Yeah.
And then he could have more damage where he can't walk anymore. So that's a super scary surgery that we've been afraid of pretty much since we got his diagnosis.
Absolutely. Well, and then his hydrocephalus, so at 3 months old, he had, his brain just kept growing and growing and growing. Roman had a very big head when he was little. So they did a procedure that was pretty new. Our neurosurgeon, he loved it. It was his baby. It's called the endoscopic third ventriculostomy, or an ETV for short. But they basically go in and drill a little hole in the base of the brain to help the fluid drain. So you wouldn't need any actual hardware inside your body, because the other option for hydrocephalus is called a VP shunt, like we've talked about a couple of times, where they put a tube inside your head and it runs down into the abdominal cavity for his particular one, that it drains the cerebrospinal fluid and then your body absorbs it and flushes it out. So that was way more scary for us because there's a lot of repairs that have to go with that. It's hardware.
Yeah, you see kids get their shunt and then they have 2 weeks later, they have to have another surgery. A month later, they have to have another surgery. I mean, it's just, it can be terrible. And they say every single time you go into the brain, you lose IQ points. So it's really, that was really scary. We wanted to do everything in our ability so he would not have to have a shunt. We were terrified of his shunt.
Yeah, that was something. I remember we measured his head with those little paper tape measures. We measured his head multiple times a day.
It was obsessive.
It would call anything changed, is it changed?
And then we had to look for these different signs in him. And when he's a baby, he can't talk to us. He can't tell us how he's feeling. We just had to guess.
Yeah, sunsetting, which is your eyes dropping down, and vomiting, crying. So babies spit up. They do weird things with their eyes. They cry, like regular stuff. But every single thing that he did, we had to wonder if it was a normal thing or it was a Spina Bifida thing. It was constant with that
whole
too.
First year, we lived in fear.
Awful.
It was bad.
And I kind of want to go down that road for a second. I remember there was one, he was having headaches, and you guys got concerned about the shunt.
Yeah, so he had the surgery that Adam was talking about, and I think it was 6 months later after that, his neurosurgeon decided that he needed a shunt. That surgery just wasn't doing quite enough for him.
And he did a behavioral and cognitive evaluation with somebody, I forget what it was called, but he tested, it was average. A couple things were a little bit below average, but our neurosurgeon was like, I want him to be at the top of the class. I don't want him to struggle through school. So I think it's time to pull the trigger and do and get the shunt placed.
Yes. Yeah, so at 9 months old, he got the shunt. And like I said, we were so scared. We thought if he ever got a shunt that we wouldn't be able to live our life because we would constantly be living in fear. But once he got the shunt, it was the total opposite. We could finally relax. We didn't have to measure his head all the time. We didn't have to stare at him and be like, is this normal? Instead of looking at our baby, we're looking at him, evaluating him constantly. So it was just such a sigh of relief to get the shunt, and something that we never do. We feel so relieved about. But thankfully, he's had it now for 3 years.
Almost.
Yeah. And he has been doing amazing. He has had no issues.
but there's still, worries and concerns. I mean, there's, like you were talking about earlier about a headache, you don't really realize when your kids say you have a headache, it's like, oh, okay, well, he must be dehydrated or, something. But with Roman, it's like, oh my gosh, what's this? Or we really hope that he's always the second kid to get the stomach flu at our house, because if he's the first one, then we're like, holy crap, he's barfing for no reason. What are we going to do here?
And that's a sign of pressure.
That's a sign of pressure in the brain. It's like every appointment that you go to, you're just still concerned that he might have hydrocephalus buildup, or MRIs or anything that you're working with. So
and when he gets an MRI, the kind of shunt he has is a magnetic shunt. So any type of strong magnet can change the setting in his shunt, and it has to be super strong, like an MRI. So when he gets an MRI, they have to change the settings back to where it was before. And if they don't change the settings properly, it can cause him to either overdrain, where too much fluid is coming out of his shunt, or
build back
up. So they need to be right where they are supposed to be. Well, at his last MRI, the nurse read the x-ray wrong, and long story short, put his shunt at the wrong setting.
Like the complete opposite setting that it should be.
Right. So he was over draining really bad, and it was causing him to have these excruciating headaches. Like he would just scream bloody murder, and there's nothing you can do. You can't give him ibuprofen and it'd be better. Like there's literally nothing you can do. So we went through a couple of days of just watching him be like that before we were like, this is not right. Like we were
communicating back and forth with the hospital.
Yeah.
They told us this was not related,
and that he would adjust. And we finally were like, no, this is not.
But I'm the one who calls every neurosurgeon or nurse practitioner that's there to figure out their answer and what's going on, and getting on the phone with our nurse practitioner from St. Louis and our neurosurgeon in Orlando. And it's like, this is my life with this, to make sure that everybody knows what's going on, because we've just heard so much. We know a lot about this, and sometimes the physicians, they don't know your kid. They don't know what's normal for him. So for us, we take a lot of pride, especially me, as being the advocate, for that person, and to have to do this, because
you have to be their voice, because they don't, especially at Roman's age, he doesn't have a voice. He doesn't know. So you have to fight for. I mean, we could have just been like, okay, well, he's just going to have headaches. But, I mean, we were like, no, this is not right. We are coming back in. You're going to change his shunt setting. He's not going to adjust.
I think we went 3 times.
Yeah. And finally, they got it right, and he's good now.
Just for the record, I would have probably learned 3 or 4 different languages, because I'm just like you, Adam. I'd have been calling people from other countries, be like, all right, he's got a headache for 2 days. Tell me what's going on here. It just freaks me out. Tell me about his, is he susceptible to anything having spina bifida, such as, again, you talk about colds. Obviously, we're in the world of COVID right now.
Well, the thing about upper respiratory is he went to the hospital for RSV when he was about 2, maybe. And then he also went to the hospital for influenza at one point. But a big part of our respiration is in our core. And when Roman has a very weak core because of his nerve issues, he doesn't get that good deep in and out. And then you throw on the fact that he doesn't run around as much like a typical 4-year-old or 3-year-old, that when you have a lung issue, you're breathing in and out, you're running and playing still. He doesn't do that, especially when he's sick. His legs get really weak and he doesn't want to walk at all. So then all that stuff just sits in your lungs. So for Corona or COVID or whatever, we have a little bit of concern with him, because obviously this is something that could be affected. But the other concern that we had was when they were talking about all of these ventilators being full and them having to make decisions on who was going to be put on a ventilator. When this all began, since Roman has special needs, I don't know if that would have put him to the bottom of the list on that, but that's also something, that irrational fear that was there, but something to think about with that.
Yeah, but really though, he has a healthy immune system. He is healthy, and he gets things and fights them off just like our other kids do.
So let's tell you what, let's jump to the fun part, the feel good about this. So you're videotaping him, and his dog Maggie's with him. Tell me about that 7-second video, or 9 seconds, whatever it was.
Yeah. So I am like, I video my kids and put them on Facebook all the time because I think they're the most adorable things in the world. So as always, I was videoing Roman, and he was learning how to walk with his forearm crutches. He was 2.
Yeah.
No, he was like 1.
It was last year, so yeah.
No, he was like almost 1.5. And so, right? Hang on a second.
So I don't believe, I think he was 2 because he's 4 now.
Okay.
He is your child, right?
I think, yeah.
No, I'm not good with numbers.
It's all right. I'm the birthday. Remember, that's why all of our kids have holiday birthdays, by the way.
Anyways, okay, so he was 2. So I'm like really impatient. So I'm like constantly working with him and being like, what can we do next? What is our next milestone? What are we going to do? So we would do therapy all the time in the house. We were just constantly working on things. And so I was like, oh my gosh, he can maybe walk with forearm crutches. Like we got him a walker, and he immediately picked up on that and knew how to use his walker. So I was like, well, maybe these forearm crutches will work. And everyone was telling me, probably not, he's not quite old enough. He won't understand. It's a hard thing for them to learn. And I was like, okay, well, we're going to learn it. So we were working really hard, and he was starting to get the hang of it. And so I was videoing like every single time he practiced with them. So I was videoing this, and we would always have him walk in our hall upstairs because that was like our longest straight point. And so he was walking down the hall, and Maggie, who was always right beside him, and he was actually walking for like the first time all on his own, and he was just so proud of himself, and he was like, look, Maggie, I'm walking, Maggie.
Look, Maggie. I'm walking, Maggie.
And it was like the cutest thing with the cutest voice, and he was so proud of himself. And so I posted it on Facebook, just like I always do, onto his Facebook page, and it just went crazy.
Oh yeah, it exploded quick.
Yeah.
I tell you what, you guys actually owe me money because I lost a lot of money that day in the office. My office manager, she'd come back and she'd be like, they've got 10,000 views on this thing. 5 minutes later, like, there are 50,000 views on this thing. I didn't even really know what that was as social media at the time, but then all of a sudden it's 100,000, 500,000. I'm like, what in the world? So the whole day I kept hitting refresh to see what the heck was going on, because I've heard of things going viral before and so on and so forth. But oh my gosh, that was a whole day of my life. That was actually a whole lot of fun just watching that go crazy.
We were texting like my dad back and forth. He'd be like, tell me the numbers, and like we would just look at our phone. We wouldn't even have to refresh it, and the shares were going up by 10s, 20s, 30s. I mean, for days in a row. Yeah. Like we were like, it's going up by 200 now.
Well, and this was his own page, mm-hmm. because we started a Facebook page for him when he was right before his ETB surgery at 3 months, because we wanted to kind of separate out our lives. So if people didn't want to hear all the updates, they didn't have to. But so he had his own page, Defying Odds, at that point.
Yeah.
So that's where all this was shared off of. And then the shares, but then the messages started coming in. And that, I think, was probably the most like kind of heartwarming things to see, on how many people were just so inspired by him, and how many, we had multiple people. I was getting ready to commit suicide, and I saw this video of this little boy, and it just gave me hope, that I'm able to push through this. And that was a pretty regular occurrence that we've seen, or,
people with Spina Bifida being like, I haven't picked up my crutches in so long, but he has inspired me. I'm going to try to start walking again. And I mean, just so many messages of just like,
people thinking about terminating their babies and not doing it, and one of the coolest things to look at now is, I remember the first time I Googled Spina Bifida in kids or something like that to see, and it's just, it was filled with kind of these like WebMD and Wikipedia definitions, and you see kind of all the worst of the worst situation. Now, if you type in Spina Bifida toddler, it's Roman.
Yeah.
So
yes.
all a Roman, that's like because his SEO with Google is top notch, to say the very
and it's
least.
just so awesome that we know other parents just like us are Googling this stuff when they get their diagnosis, and they get to see Roman, and they get to see, oh my gosh, like he's a typical kid, like he's a normal kid, like he isn't spina bifida, like that's all you can think about when you get that diagnosis. And to see that he's just like a normal kid, I mean, it's got to just give you so much hope for your kid,
I'll say it since you won't. He's also adorable, of course. That certainly doesn't hurt. But you know what is really wild is I was in my practice, and this went on for quite some time. But people would come to me and say, "Oh man, have you seen this kid named Roman? Like, what do you know about spina bifida?" And I said, "Well, what do you want to know? Because he's my great nephew." And is that what he is to me?
Yeah.
Yeah. Is that how that works? Yes.
Mitch, that stuff happened in my office too. People would come in and ask me about this little boy. Yeah, and then it was my kid.
What do you say to that when they're like, "Hey, have you seen this kid with spina
I
bifida?"
still am super awkward talking
we
about
both
it.
they're like, oh, we were at Costco the other day getting gas, and this lady was like, "Are you Roman's mom?" And I was like, "Yeah." And she was like, "Oh my gosh!" And he happened to be in the car with me, and well, they all were. And I was like, "You can come say hi to him." So I rolled down the windows, and she was just like starstruck. And it was we're so awkward. We're like, yeah, that's it. I mean, we don't know what to say. It's really
because who's prepared for this? We didn't try to become influencers on Facebook or YouTube or anything like that. This was all an accident, and it just kind of blew up. And now we love it because there's so much negativity on the internet, especially with what we're dealing with now. It's constant arguing, constant people with just these hateful things to say. And then we have Roman, this like beam of love.
Air.
You know what I mean? And
I'm really not sure that it's I don't know if it was luck or whatever you think. I think all those prayers you guys did, people praying for you, that incredible faith that you had, you know what, it's got to be divine intervention to me.
Absolutely. I mean, to not see.
Yeah, and I always say, like, a lot of people, bad things happen to good people. Bad things happen all the time. And a lot of times you have faith that it happened for a reason. You don't know why, but you just have to believe it happened for a reason. So for us to be able to get to see these people telling us that they didn't commit suicide, or, that they have so much hope, Roman pulled them out of a dark depression, like we get to see that other side. Like, we got the terrible diagnosis and we thought it was the end of the world, and then we get this side of it, and a lot of people don't get to see that happy ending.
Absolutely. And it's crazy to show just, God's promises, because it hurt. And there's a lot of times that, you still go through hard times, and there's going to be hard times, and God doesn't promise you that you're not going to have hard times in your life. But to show the other side and to see the other side of this, it just gives you hope for the future too. On like, we're going to go through things like this. It's going to happen. But to see, look what God did with this. Look what God did with prayer. Look what God did, with his health and with all these blessings. And even me being a chiropractor, but we work with a lot of pediatrics in our office, and just seeing that the chiropractic miracle aspect of it, there's something we don't even talk a whole lot. We, because I don't ever want to make this about promoting my business, and I never have from the get-go, but to see what chiropractic's done in that little boy, and to see when he has a shunt headache, he gets an adjustment and the headache goes away. When he's a little wobbly, you can do a little bit of pelvic work on him, and it strengthens his legs up, and he gets going a little bit better. Constipation, ear infections, all these little things that you see with him, you get to see that, why God gave a chiropractor a son with a neurotube defect that's a spine condition. That's pretty ironic in just that.
It sure is.
So to see that, and I just remember making phone calls to all these big pediatric doctors and being like, Tim, how do I fix this stuff? How do I help him?
Because everyone tells you, no, he cannot get adjusted. Like,
oh, yeah.
You have to stay away from chiropractors. And we're like, he's been adjusted since
he was in the NICU, an hour old, and that's something that we see a lot. And we try to promote any comment on Facebook in a Spina Bifida group that talks about chiropractic. Whitney gets tagged in almost immediately. So she can we can find the right chiropractors for them. And still most people are terrified to bring their kids to a chiropractor, but it's the least we can do to help.
That's what you guys have done. I think you've helped so many people. And you know what? It kind of started as a spina bifida, but man, this kid's taking this whole thing to a whole new level. It's about everything now. I mean, he's an inspiration for fun, for happiness, for joy, keeps people out of these things. And that's got to be kind of cool.
Yeah.
It's so fun.
Cool.
It's so fun.
Well, I tell you what, guys, just knowing you both, you guys have done a magnificent job. You can't ever stop posting that stuff. You have to, and I think he's got to do it all the way up until he's an old man. Everybody's going to follow him. Want to see kind of how he turns out and what ends up happening with him. But I just want to tell you guys, I'm so proud of you for listening. Your faith, everything that you've done. It obviously turned out this way for a reason. And God, I just couldn't be more proud of you guys.
Thank you.
Well, thank you.
That means a lot.
And I'm not just saying that because I'm related to you either. And for those watching, because I have to throw this in, because there are people that do watch the videos and watch how he walks, and it's not 100% spina bifida with that walk. A little bit of that is Dinkel.
He's got a little Dinkel gait.
He's got Dinkel gait in him. Oh my God! I had to throw that in. There was no way I was leaving that.
I guess I walk weird. I don't notice it because I feel like it's a normal way to walk. So all my kids are blessed with that one stride.
I think Gracie got my stride.
That's a praise God.
You guys are going to have a million hits wanting to see you walk from behind, and I think you should absolutely do that video. Otherwise, it's a disservice.
VIP. That's how it is. Yeah.
All right. Thank you guys so much. I love you both immensely. You know that. And keep sharing it to the world.
Thank you. We love you too.
All right. We'll talk to you. Bye-bye, guys.
Bye.